Welcome back. If you've just joined us, you're watching the news at 10 on Channels Television, live from Lagos. A reminder of our top stories. Large turnout of voters in the Osun State governorship election. Main parties in the poll disagree over the role of security agents in the exercise. Kwara State APC and PDP trade blame over the defacing and destruction of APC billboards in Ilorin. Experts advise against panic measures as fears over the spread of Ebola virus mounts. And U.S. President Barack Obama vows to stop the jihadist state as he admits stabilizing Iraq will be tough. We'd like to remind you that all our top stories can be found on our website, channelstv.com, and on youtube.com/channelsweb. Please visit m.channelstv.com to view us live on your mobile device. You can also download the Channels TV app for Android, iOS, and Windows phones from their respective stores. We also urge you to interact with the Channels Eyewitness feature on our Android, iOS, and Windows 8 platforms. If you have pictures or videos to share with us, tap on the app on your device, swipe to reveal the Eyewitness menu, and follow the instructions. The youth of Nigeria have the votes required to change the country for the better. That's according to President Goodluck Jonathan, who challenged some youth at an international summit organized by the Nigerian Young Professionals Forum in Abuja to maximize their potential. The president said he is in support of sending a bill to the National Assembly to amend clauses in the 1999 Constitution that discriminate against young people.
The hall was filled to capacity. Young Nigerians were joined by President Goodluck Jonathan and some of his ministers at this summit, which focused on fostering national integration and purposeful leadership. The president said his administration believes in the capacity of young people in the country to change the Nigerian story.
I think what the youth will do now is maybe to come together. I will support you to take a bill to the National Assembly to amend some parts of our constitution that have discriminating policies in terms of age. Because there's no reason why, if you go out and then to go this country at the age of 32, there's no reason why.
The coordinating minister of the economy also encouraged young Nigerians to look at politics as a means of forging a new way for society.
What we need are individuals who think beyond themselves and who fundamentally understand that the success of the individual is dependent on the success of society, and therefore that we must look at politics beyond the individual, politics beyond the group, and politics for the nation. These are the things that the president outlined, that we are more hopeful that as we look at our young people, you're really looking beyond what is now called stomach infrastructure.
The special advisor to the president on youth said it is time for young people to take a stand.
Now that we are here, what changes are we trying to make? Nobody can bring Nigeria for us more than the young people. Nobody can bring Nigeria for us more than the younger generation. So the younger generation must stand aright. This is the time we are being called upon to define where we stand.
It's a position the chairman of the forum agrees with.
Our next point of call is to challenge our representatives at the National Assembly level to come up with laws that will eliminate age barriers into political offices.
As part of the agreement at the end of the summit, the forum recommends the restructuring of the Nigerian educational system and other initiatives to encourage young Nigerians and help them excel. Lanre Lasese, Channels Television News.
We'd like to turn our attention to health now, and Nigeria recorded, tragically, a second Ebola-related death this week, even before the 3-week incubation period was over. The victim was a Nigerian nurse, the Nigerian nurse who helped care for the late Liberian-American Patrick Sawyer. 6 other primary contacts who tested positive for Ebola have been isolated from the public, bringing the total number to 8. In spite of this, health officials say that enlightened self-help and cooperation amongst concerned parties, rather than panic, is the answer to the growing concern within Nigeria.
It was a sad day when the first case of Ebola died on Nigerian soil on the 20th of July. Liberian-American Patrick Sawyer, who flew in from Liberia, where the Ebola virus disease is endemic. Since then, a Nigerian nurse who attended to the late Patrick Sawyer tested positive to the virus and died on the 5th of August, just over 2 weeks after contact with the patient. The federal government confirmed 6 other cases. There seems to be a heightened sense of suspicion and fear, but the principles of precaution remain the same: vigilance and personal hygiene.
They should be observant, and when they see anybody who they suspect, it could call attention of any health officer around.
When you're handling anyone that becomes rapidly ill and progresses rapidly, you need to protect yourself. Wear gloves, wash your hands after you touch the person, and call us.
According to the authorities, all cases are now in quarantine. But if they were isolated after they came down with symptoms, what happens to the secondary contacts, members of their families?
Ideally, they should all be rounded up. What actually should be done is people can also cooperate by turning themselves in.
Hand washing is important to keep away infections, and this is the method.
It's better you have the liquid soap, which you can just dispense by pushing directly, so you dispense, and you form enough lather on your hand. So after forming, then first of all, you wash the surfaces, then you take care of the in between the fingers, you wash properly, then you go behind, you wash the back, and you also wash the back here, not forgetting that we haven't washed the thumb. So you comb like this and wash the thumb, you wash the thumb, then you wash the wrist. Then after washing the wrist, you go under the running water and you now wash everything.
And on the assumption making the rounds that bitter kola can cure the disease, this is what the experts have to say.
All the researches we have done in the past and all the research questions we are yet to answer now need to be taken seriously.
Ebola is a deadly viral disease which can kill up to 90% of its victims, and according to WHO, has claimed at least 930 lives in this episode across Guinea, Liberia, Sierra Leone, and Nigeria. Symptoms are severe headache, fever, vomiting, diarrhea, internal and external bleeding. Mary Alale Yusuf, Channels Television News.
Away from the Ebola virus disease to child health issues. The first week in the month of August every year is recognized as World Breastfeeding Week to encourage breastfeeding and improve the health of babies around the world. This is necessary for a country like Nigeria that has just 17% of exclusive breastfeeding, and that's according to the 2013 Nigeria Demographic and Health Survey. On our Focus on Health tonight, our correspondent, Yomi Otaigbe, takes a look at the importance of increasing and sustaining the protection, promotion, and support of breastfeeding.
A baby enjoying what has been described as nature's best food for babies, breast milk. The age-long practice of breastfeeding provides infants with the nutrients they need. The World Health Organization recommends exclusive breastfeeding starting within 1 hour after birth until a baby is 6 months old.
Breastfeeding is the unequal way of providing ideal food for the child. It contains all the nutritional requirements for adequate growth and development. And coupled with that, it ensures optimal growth. The child grows well, the brain is well developed, there's no diarrhea, and later in life, for the health of the child, there are anti-infection substances that protect the child from diseases. And a child that is well breastfed later in life is protected from some forms of cancers like ovarian cancer, breast cancer, and same suffice for the mother. When a mother breastfeeds, the health is protected. This post-delivery hemorrhage is reduced. The mother is also protected from some forms of cancers, and for the family, it does not cost anything.
27-year-old Mrs. Hawal Bakare's testimony concerning the nutrition and health of a 4-month-old twin babies points at the important role breastfeeding plays in a child's healthy growth and development.
You can see them now. I've already breastfeeding them, so they did not disturb me. It's because they're okay, because I'm eating very well, so that the food that they are sucking in my breast is okay, it's catching them. So I'm very grateful. So they did not disturb me. Then I didn't take them to hospital for maybe treatment or any other thing. Then me too, I'm very happy because they're not crying. If I breastfeeding them, they will sleep, I will walk, then I can do anything that I want to do in time.
Perhaps lots of mothers desire to exclusively breastfeed their babies, but there are challenges.
I think lack of knowledge is one, because some mothers do come to the health centers with complaints that the milk is not coming, the child is not feeding well. Number one, when there's late initiation, it's a great challenge, because the initiation will bring up the reflex for milk production. So the earlier the child is initiated to breastfeeding, the earlier the brain it's receiving message that it's time for action, and the milk will come up and it will flow. Then positioning and attachment. Many women don't know much about positioning and attachment. If the child is not well positioned, the child will be latching on the nipple and not the areola. And when the child is latching on the dark area of the mouth, of the breast, and the lips cover that dark area, there's a reflex we call oxytocin. There's a hormone that will receive a reflex for the flow. It will encourage the flow, the milk will flow well. Because when you talk exclusive breastfeeding, after 3 months, the mother has to resume at work. And in some workplaces, in the government, maybe they close by 2. In some workplaces, then they don't allow it. But we still say it is still not a challenge. The milk can be expressed by this mother. Only you need someone that has knowledge at home. When the mother expresses the milk, this milk can stay for 8 hours and nothing will happen to it. Even if you don't put it in the refrigerator, you just ensure that you keep it in a covered cup, and the cup feed the child. We don't want bottle feeding, because evidence has shown that bottle feedings encourages bacteria and diarrhea.
For the mothers to be able to lactate well, number one, nutrition comes in. They must eat accurate, good diet, which contains both carbohydrate, vitamins, and protein. Because these little children, these poor children, depends on what the mothers have in them. There should be enough drink for the mothers. Let them drink enough of water. If some could drink ogi, that is pap, let them take pap.
We are happy with the new law in Lagos State, where the governor has been able to extend the maternity leave for mothers to 6 months, and then the paternity leave for the fathers for 10 days. This is laudable. This is commendable. The theme last year was breastfeeding support close to mothers. We've been asking for support from policymakers, from the community, from the family, and this is a good step in the right direction, because with this period now of 6 months, the mothers can stay back home and breastfeed exclusively. And we're looking at a situation where the private sector can also buy into it. Other states in Nigeria can do the same. And even the federal government as well can bring up the law so that mothers can spend more time with their family.
That breastfeeding has scientifically proven health benefits for both the mother and child is not in doubt. Continued education during antenatal period and support by family members and, of course, baby-friendly policies will help in the sustenance of this crucial nutritional need for babies. Yomi Otaigwe reporting for Channels Television News.
Still ahead on the news at 10. Nigerian Bulk Electricity Trading Company and the Nigeria Sovereign Wealth Fund to manage a $350 million investment for the financing of electricity generation. That's on Business News. Please join us.